An orthopedic surgeon has a serious warning for seniors over 75 if you think stretching alone protects your joints. You might be making a mistake that could weaken your muscles and increase your risk of falls. One of the most important changes that happens in the body after the age of 70 is the gradual loss of muscle mass. Medical experts call this process age-related muscle loss after the age of 75. This process can accelerate if the muscles are not used regularly. Many seniors believe that stretching alone is enough to keep their bodies flexible and healthy. While stretching does help with flexibility, it does very little to maintain muscle strength. Muscles are the support system of the entire body. They stabilize the joints, protect the bones, and help us perform everyday tasks such as standing up, climbing stairs, carrying groceries, or even getting out of bed. When muscle strength decreases, the joints begin to take on more stress. This can lead to pain in the knees, hips, shoulders, and lower back. Orthopedic surgeons often emphasize that gentle strength training is one of the most effective ways to slow down muscle loss in seniors. The good news is that strength training does not mean lifting heavy weights at the gym. For seniors over 75, simple and controlled movements are more than enough to activate and strengthen the muscles. Exercises such as chair squats, wall push-ups, light resistance band movements, or lifting small hand weights can significantly improve muscle strength. Even everyday activities like standing up from a chair without using your hands can become a powerful exercise when done repeatedly and with control. Strength training also plays a critical role in protecting bone health. As we age, bones naturally lose density, which increases the risk of fractures. When muscles work against resistance, they send signals to the bones to stay strong. This process helps slow down bone thinning and keeps the skeletal system healthier. Another major benefit of strength training is improved independence. Seniors who maintain muscle strength are often able to continue performing daily activities without relying on assistance. This means greater confidence, better mobility, and a higher quality of life. Orthopedic specialists usually recommend performing gentle strength exercises 2 to 3 times per week. Each session does not need to be long. Even 10 to 20 minutes of consistent exercise can make a noticeable difference over time. It is also important to start slowly and focus on proper form rather than speed. Controlled and steady movements help prevent injury and allow the muscles to gradually adapt to the activity. If a senior has joint pain or medical conditions, it is always wise to consult a healthcare professional before starting a new exercise routine. The key message orthopedic experts want seniors to understand is simple: stretching helps flexibility, but strength keeps the body functional and protected. By incorporating gentle strength exercises into daily life, seniors over 75 can maintain their mobility, reduce their risk of injury, and continue enjoying an active lifestyle for many years. As people grow older, balance naturally becomes weaker. This happens because the muscles that stabilize the body become less active and the communication between the brain and muscles slows down. Many seniors do not realize that balance is a skill that must be practiced regularly. Just like strength or flexibility, stretching may help loosen tight muscles, but it does not train the body to maintain stability. That is why orthopedic specialists often encourage seniors over the age of 75 to include simple balance exercises in their daily routines. One of the biggest health risks for seniors is falling. Falls are one of the leading causes of injury in older adults. A fall can result in fractures, joint injuries, or long recovery periods that limit mobility. In many cases, falls happen not because the person was weak, but because the body could not maintain balance during a sudden movement. Balance exercises train the body to respond quickly and maintain stability when walking, turning, or standing. These exercises strengthen the small stabilizing muscles in the legs, ankles, and core. They also improve coordination between the nervous system and the muscles. The good news is that balance training does not require complicated equipment or long workouts. Simple activities performed at home can make a significant difference. For example, standing on one foot while holding on to the back of a chair can help strengthen stabilizing muscles. Heel-to-toe walking, where one foot is placed directly in front of the other, is another effective exercise that improves coordination. Slow side steps or gentle weight shifting from one leg to the other can also help train balance. Practicing these movements for just a few minutes each day can gradually improve stability over time. Seniors may notice that they feel more confident when walking, climbing stairs, or moving around their home. Another important factor in balance is posture. Standing tall with the shoulders relaxed and the head aligned over the spine allows the body to distribute weight properly. Poor posture can shift the center of gravity and increase the risk of losing balance. Balance training also improves confidence. Many seniors develop a fear of falling after experiencing instability. This fear can lead to reduced activity, which actually weakens the body further. By practicing balance exercises regularly, seniors can regain confidence in their movements and remain active. Orthopedic specialists often remind their patients that balance is not something that improves overnight. Like any skill, it develops gradually with consistent practice. However, even small improvements in balance can significantly reduce the risk of falls and injuries. For seniors over 75, adding just 5 minutes of balance training each day can be one of the most powerful ways to protect their health and independence. Joint stiffness is one of the most common complaints among seniors. Many older adults notice that their knees feel tight in the morning, their hips feel stiff after sitting for long periods, or their shoulders lose their range of motion over time. While stretching may temporarily relieve this stiffness, it does not always address the deeper cause. Orthopedic specialists explain that joints are designed to move regularly. Inside each joint is a fluid that acts as a natural lubricant. This fluid helps the joint surfaces glide smoothly against each other during movement. However, when joints remain inactive for long periods, this lubrication decreases and stiffness begins to develop. That is why low-impact physical activity is so important for seniors over the age of 75. Gentle movement stimulates circulation around the joints and encourages the body to produce more joint lubricating fluid. Walking is one of the simplest and most effective activities for maintaining joint health. A short walk each day helps keep the knees, hips, and ankles active while also improving cardiovascular health. Even a 15-minute walk can significantly reduce stiffness and improve mobility. Swimming or water exercises are another excellent option. Water supports the body's weight, which reduces pressure on the joints. This allows seniors to move more freely while strengthening muscles and improving flexibility. Cycling on a stationary bike is also considered a low-impact exercise that is gentle on the joints. The circular motion of pedaling helps improve joint mobility while strengthening the muscles surrounding the knees and hips. Low-impact activities also help maintain overall circulation. Improved blood flow delivers oxygen and nutrients to the muscles and joint tissues, helping them repair and maintain their function. Consistency is the key to success with low-impact exercise. Instead of performing intense workouts occasionally, orthopedic experts recommend incorporating gentle movement into daily life. Activities like gardening, light household tasks, or leisurely walks can all contribute to better joint health. It is also important to listen to the body. Mild muscle fatigue after activity is normal, but sharp or persistent pain should never be ignored. Seniors should choose activities that feel comfortable and enjoyable, allowing them to stay active without placing excessive stress on their joints. By maintaining regular low-impact activity, seniors can keep their joints flexible, reduce stiffness, and support long-term mobility. Maintaining strong bones becomes increasingly important after the age of 75. As the body ages, bone density gradually decreases. This natural process can make bones more fragile and more susceptible to fractures. Orthopedic specialists frequently emphasize that nutrition plays a vital role in protecting bone health. Even the best exercise routine cannot fully support the bones if the body does not receive the nutrients it needs to maintain strength. Calcium is one of the most essential minerals for bone health. It provides the structural support that keeps bones dense and strong. Foods such as yogurt, milk, cheese, leafy green vegetables, and almonds are excellent sources of calcium. Vitamin D is equally important because it helps the body absorb calcium effectively. Without sufficient vitamin D, the calcium consumed in the diet may not be properly utilized by the body. Sunlight exposure and foods like fatty fish, eggs, and fortified dairy products can help maintain healthy vitamin D levels. Protein is another key nutrient for seniors. Many people associate protein primarily with muscle health, but it also contributes to bone repair and maintenance. Lean meats, fish, beans, nuts, and dairy products are valuable sources of protein that support both muscle and bone health. Hydration also plays a role in maintaining joint and bone health. Drinking enough water helps maintain the lubrication of tissues and supports overall metabolic functions in the body. Orthopedic experts often encourage seniors to focus on balanced meals that include a variety of nutrient-rich foods. Colorful fruits and vegetables provide antioxidants that help reduce inflammation and protect cells from damage. Healthy nutrition works together with physical activity to maintain bone strength. When the body receives the right nutrients and engages in regular movement, the bones receive signals to remain dense and resilient. By prioritizing proper nutrition, seniors can significantly reduce the risk of bone weakness and fractures while supporting their overall health. The final recommendation orthopedic specialists often share with seniors is the importance of moving smarter, not harder, as the body ages. Joints become more sensitive to sudden or excessive strain. Learning proper movement habits can greatly reduce the risk of injury. Many everyday activities place stress on the joints without people realizing it. Bending improperly, lifting heavy objects incorrectly, or twisting suddenly can strain the knees, hips, and spine. Using correct body mechanics can help protect these vulnerable areas. For example, when lifting an object from the floor, it is better to bend the knees and keep the back straight rather than bending forward at the waist. This technique allows the strong muscles of the legs to perform the work while protecting the lower back. Similarly, when standing up from a chair, engaging the leg muscles rather than pushing heavily with the arms helps maintain strength in the lower body. Posture also plays a crucial role in joint protection. Sitting or standing with a slouch posture places uneven pressure on the spine and surrounding joints. Maintaining an upright posture helps distribute body weight evenly and reduces unnecessary stress. Another helpful strategy is to move slowly and deliberately. Quick, jerky movements can strain joints and muscles that may already be weakened by age. Controlled and mindful movements allow the body to maintain stability and avoid injury. Footwear is another factor that affects joint health. Supportive shoes with proper cushioning can reduce stress on the knees, hips, and lower back while walking. Orthopedic specialists often remind seniors that protecting the joints does not mean avoiding activity. Instead, it means learning how to move safely and efficiently during daily tasks. When seniors develop these smart movement habits, they can continue performing everyday activities comfortably while reducing the risk of pain and injury. As we learned today, stretching alone is not enough after the age of 75. While flexibility is important, your body also needs strength, balance, daily movement, proper nutrition, and smart movement habits to stay healthy and independent. The good news is that it's never too late to start making small changes that can have a big impact on your health. Even a few minutes of gentle exercise each day can help protect your joints, strengthen your muscles, and reduce the risk of falls. Taking care of your body today can help you enjoy a more active and comfortable life tomorrow. If you found this video helpful, make sure to like the video and share it with a friend or family member who could benefit from these tips, and don't forget to subscribe to Senior Health with Grace for more simple, science-backed health tips designed especially for adults over 50. Thank you for watching, and remember, healthy habits today create a stronger tomorrow.